In 1956, German company Kimi Grunenthal would release the drug Contergan, marketing it as a non-addictive, non-barbiturate sedative. The drug was found to be very effective at sedation, as well as having antiemetic effects. These traits made it very popular among pregnant women dealing with insomnia and morning sickness early in pregnancy. The drug would become widespread in 46 countries under many different names, such as Softenon in Western Europe and Distaval in the UK. It was available over the counter in Germany, and the British company, the Distillers Company, once said that Distaval can be given safely to pregnant women and nursing mothers without adverse effect on mother or child. We'll see how well that worked out for them in just a minute. In fact, this drug would widely be marketed as safe until November 1961, when the drug would ultimately be banned in multiple countries due to large numbers of birth defects seen in children of mothers who took the drug early on in pregnancy. This is now widely viewed as a failure of drug testing worldwide. And you might know it by its generic name, thalidomide. Hey everybody, my name is Casey. I'm the lead scientist here at Lichen Laboratories. Today I bring you an in-depth analysis of the thalidomide tragedy, as well as examining exactly what happens during development that leads to such birth defects as the ones we're aware of. So, without further ado, let's get into it. First, let's talk about the structure and function of thalidomide for a moment. Thalidomide is what is known as a chiral molecule, which means that there are two forms that are mirror images of each other that cannot be superimposed. The best way to think about this is actually to look at your own hands, which are exactly that, mirror images that just cannot be superimposed. The two forms of thalidomide are as follows. The R form, seen on the right, is perfectly safe and causes sedative effects. The S form, the one on the left, is the form that causes the teratogenesis in developing fetuses. Unfortunately, these forms interchange pretty regularly at the pH of a human body. Yeah. Unfortunately, these forms readily interchange at the pH of a human body, meaning it's unpredictable which form will be present at any given moment. Now, before we go any further, I think it would be useful to define the term teratogenesis. Terato is a prefix that comes from the Greek word for monster, and genesis comes from the Greek for beginning or production. So, altogether, this is the process of making a monster. It's a word used to describe a process during fetal development that causes severe malformations, usually caused by chemical disturbances or drugs. Now, reasons drug testing for thalidomide failed so spectacularly included the way that this drug interacts with animal model. Reasons drug testing for thalidomide failed so spectacularly include the way the drug interacts with animal model. Reasons the drug testing for thalidomide failed so spectacularly include the way that the drug interacts with animal models. Small animal testing was the standard of the time, and human trials were not yet required in order to get medications approved. Unfortunately for us, in small mammals, it was found virtually impossible to give a lethal dose. Mice, in particular, were found to be far less sensitive to the. Mice, in particular, were found to be far less sensitive to thalidomide than humans, or even other non human primates. Another factor leading to the disaster of thalidomide teratogenesis was that medication use in pregnancy was not yet strictly regulated. We didn't have an idea about how drugs migrated past. We didn't have an idea of how drugs migrated through the placenta yet. In the early 1960s, two independent doctors would confirm the teratogenic effects of thalidomide. These were German doctor Wiedekind Lenz and Australian doctor William McBride. This would come a little too late, however, as over 10,000 severe birth defects and another large number of miscarriages had been confirmed. It's important to note that thalidomide was never approved for use in the United States. This is due to a single person, a woman, obviously, Frances Kelsey, who was a physician in charge of drug licensing at the Food and Drug Administration. She had been concerned about thalidomide causing neuropathy, which is a type of nerve damage that can cause pain or numbness, as well as the possible effects during pregnancy. For this action, Kelsey was awarded the President's Award for Distinguished Federal Civilian Service by President John F. Kennedy. She was also responsible for writing documents that would later lay the framework for modern drug testing. Now let's talk a little bit about how thalidomide worked in developing embryos and how it caused such massive effects on development. The damage was primarily in the limbs, more often the upper than lower. Also affected were facial structure, including eyes and ears, genitalia, heart, kidneys, and the gastrointestinal tract. Mortality was estimated to be as high as 40% due to internal damage. The most common symptom of thalidomide teratogenesis was limb malformation. Specifically, there were defects known as phocomelia, a shortening of the long bones of the limbs, and amelia, a loss of those same bones. In the most severe cases, only the hand plate would be left, leaving a flipper-like structure to articulate with the shoulder and hip joints. Less severe cases would consist of something like radial dysplasia, a shortening or loss of the thumb and the radius, which is the bone in your forearm on the thumb side. There was a characteristic pattern of severity of bone loss in the upper limbs. Less severe cases would lose only the thumb, then the radius, then the humerus, and lastly and most severely, the ulna. The lower limbs form later on in the womb, which is possibly why the upper limbs would be more affected. It was likely that higher drug concentrations were just present earlier on in development. The lower limbs also had a characteristic pattern, though, starting with the less severe shortening of the femur, then the tibia, and lastly, the fibula. Oftentimes, hips and shoulder joints would be underdeveloped as well. Now, not every single case followed this characteristic pattern, but it was common enough that it was worth noting. A majority of survivors of thalidomide would come away with some form of limb deformity, and most of the time they were symmetrical. As far as facial deformities go, a stork mark was common, which is a hemangioma or a large mass of blood vessels located in the center of the forehead that sometimes extends down over the nose and upper lip and typically disappears over the course of 2 to 3 years. Facial palsies, which are a form of paralysis, were also common, as well as cleft lips and palates, and small jaws and noses. Now, most of these effects were benign, except for the things like the cleft palates and lips, which could cause feeding problems in young infants. Internally, heart defects were responsible for a large number of miscarriage and postnatal deaths. Kidney defects noted were horseshoe kidney, where the two kidneys would grow into one horseshoe-shaped organ, which, while usually asymptomatic, could cause more common urinary tract infections. kidney hypoplasia or undergrowth, leaving less area in the organ for the filtration of the blood. Rotations, which are abnormal placements of the kidney relative to the large blood vessels they're connected to. And ectopic kidneys, where the organ fails to migrate to its proper place in the abdomen, often sitting much lower than expected, even down into the pelvis. Also noted were malformed uteruses and abnormalities in testicular development. Central nervous system issues, namely increased rates of epilepsy and autism, were also described. Now let's talk about why these things happened. What about thalidomide allowed it to be so detrimental to a fetus's development? The most dangerous window of time for exposure is estimated to be between 20 and 36 days after fertilization. Exposures earlier than this had a higher likelihood of miscarriage, while later exposures showed a higher level of brain damage in rat studies. All these studies together showed that there's likely no safe period of time to take thalidomide while pregnant. Dosage was also not a valuable indicator, as it was shown that one single 50 milligram tablet of thalidomide is estimated to cause defects in roughly one half of pregnancies. Now, the mechanism of action of thalidomide is not fully understood, but a few mechanisms have been proposed, including anti-angiogenesis, ROS production, cell death, and some downstream effects such as faulty chondrogenesis, nerve toxicity, and DNA intercalation. That's a lot of really big words, so we're going to break most of these down as we go forward. Let's talk first about anti-angiogenesis. So, early on in fetal development, a process called vasculogenesis produces these precursor blood vessels that flow throughout the entire embryo. Later on, angiogenesis comes in, cleans up, and adds more complexity to these primitive vessels, branching them off and lengthening the initial vessel itself. There's a lot of rapid changes that occur early on in embryo development just due to the amount of cell specialization that has to occur. Now, when exposed to thalidomide, developing blood vessels are rapidly destroyed. In chicken embryos, this rapid destruction of vessels can cause limb truncation or shortening. The loss of the vascular network is shown in tandem with a loss of fibroblast growth factor as well as sonic hedgehog, which are necessary cell markers for limb formation. Studies show that the vessels that lack smooth muscle coverage are more affected during this time, and that the length of exposure actually does change the severity of the limb truncation. The anti-angiogenic effect of thalidomide is backed up by the fact that other known anti-angiogenic drugs have been demonstrated to have similar effects on developing fetuses. Another possible mechanism is the increase in reactive oxygen species, or ROS products, as well as the upregulation of cell death. So, what is a reactive oxygen species, you might be asking? I'm glad you asked. These are highly reactive oxygen containing molecules that are produced during normal cellular metabolism. They include things like the hydroxide radical, which is a highly alkaline molecule that can disrupt DNA, as well as other molecules like peroxide. These can cause damage to DNA by binding to the tiny constituent molecules that make it up and causing them to bind to the incorrect things. Studies in rabbits used methods to trap molecules that occur during oxidative stress secondary to exposure to thalidomide. Trapping these prevented limb loss and also lowered the amount of toxic thalidomide breakdown products seen in the system. Thalidomide also increases the amount of bone morphogenic protein and DICOP1 present in the system, which promote normal cell death, aka apoptosis. Due to this increase, cell death in the fresh limb buds could pile on to the defects seen in the affected children. There are likely other there are likely other mechanisms involved, but the order of operations still isn't fully established, and it's possible that these are just downstream effects of angiogenesis. The proposed framework we have right now starts with thalidomide exposure and the drug breaking down in the system, which targets molecular markers, such as the ones we've mentioned already, as well as things like cereblon, which is part of a process to degrade harmful proteins that are present in cancer cells, and tubulin, which is a part of the cellular skeleton that helps maintain cell shape and function. This then targets blood vessel formation later on, which in turn increases oxidative stress and cell death, as well as affecting gene expression patterns in these early cells. These downstream effects then cause the defects we're familiar with. Thalidomide was officially taken off the market in November 1961 after over 10,000 children had been affected. In 1968, Kemi Grunenthal would go on trial for these cases. No one was found guilty, though, but the German victims were monetarily compensated. Instead of a guilty verdict, the drug approval process worldwide was changed, including adding the necessity of human trials, as well as starting to study the actual molecular effects of the drugs. Today, thalidomide has found a different home in medicine. It's currently used to treat diseases like leprosy, yeah, that one, and multiple myeloma, which is a cancer of the bone marrow common in older adults. It's a useful treatment for disease in older adults due to its anti inflammatory and anti myeloma effects. It does this by decreasing tumor necrosis factor alpha, a known pro inflammatory cytokine, cereblon, a molecule with cell death selection actions, and tubulin, a cytoskeleton protein that is required for cell proliferation. The thalidomide tragedy was just that, a tragedy. Many of those affected are still alive today and can tell their stories. It did lead to better drug trial methods, but we can only wish it didn't come at such a high cost. In the modern day, most drug testing is much safer, but we can't rule out the possibility of something similar happening in the future. Corporate greed is a strong motivator, after all, which is why we need to keep the governing bodies in charge of drug approvals accountable. Now, if you enjoyed learning about this, don't forget to subscribe for more. And until next time, thanks for hanging out in the lab. I've got to get back to work. These blood samples will not centrifuge themselves. So I'll see you guys soon. Bye bye.